Good evening, friends. I am Dr. Thomas Matthew, Medical Officer in charge, UPHC, Edakochi, it's a NRHM hospital. And I am talking about high blood pressure, that is hypertension, today. And then only some aspects of hypertension, some therapeutic aspects which is seen and difficult things to convince patients. And when hypertension is detected in a patient, this patient is, I will ask few questions. The questions are, one is, should I take this blood pressure medications lifelong? And my answer is that sometimes you have to. Second question is that, is this blood pressure medication is harmful to my body? No. None of the usual hypertensive medications are harmful if it is given by a registered medical practitioner. And we have to take blood pressure medication if the blood pressure is high. That is, if it is 140 and systolic and 90 diastolic. And why should we take blood pressure medication is one, this about one heart, the heart will be dilated and it will increase in size. We call it in medically we will say that is hypertrophied, and that leads to the failure of the heart, that is heart failure. Second, the reason the kidney will be affected, that is kidney will be pressurized, and the renin is a hormone which is produced by kidney, and it's a chemical produced by kidney. And when there is high blood pressure, and this renin will go and act on the body, and it will increase the blood pressure again. And when the blood pressure is raised again, it will more, in the kidney, renin will be produced more. So this will be a vicious cycle. And more and more renin will be produced, and more BP will be raised. So it will be, the BP will be set at a higher stage, higher state. So even after some time, then when the kidney started producing renin, we will have to give the patient more dose of antihypertensive medication. Sometimes it will not be effective, and we will have to set the blood pressure in a higher stage, higher level. The third is it is on eyes. Our eyes are very precious, and this hypertension or blood pressure will affect the eyes, the retinal arteries. The retinal artery will start bleeding, and aneurysms will be formed, that is the dilatations of the arteries in the retina. And when there is bleeding, there will be blindness. The patient will lose the vision. And fourth organ is that is the brain, which is brain also will bleed, and brain will, the bleeding area will be destroyed, and the patient can develop hemiplegia, that is a weakness of one side of the body, or a monoplegia, or the weakness of one arm and face, and or a difficulty, and many difficulties can be developed in the brain due to high blood pressure. So the patient has to, when the blood pressure is detected, the patient has to take medication properly and see doctor in intervals and check BP. And that is very, very important. That is heart, kidney and eyes and the brain are very important organs, and these will be affected in hypertension.